I am Dr. Chris Nelson, and on today's video I want to discuss how to pick a dentist. Now if you're looking for this video, you might be wondering, how do I pick a dentist? What do I do to find the right person, to find the person that's right for me? And look, I've been there before. I am a patient myself. Now, of course, if you know anything about me, my dad's a dentist, my grandpa was a dentist. So in terms of dentists, right now, while my dad is still practicing, he is my dentist. But I have been a patient in the healthcare system. I'm sure you have too. And how do we choose a provider, whether it's an eye doctor or a general practice physician, or or a dermatologist, or whatever you want to pick. How do we pick that person? Okay, I'll give you a couple insights from me as a practice owner. I've owned this practice for only 3 years at this point, but I've been working in dentistry for 16 years. I have a family history. I have a bunch of family that are physicians. I have a lot of experience in healthcare, and I worked for 13 years at a community clinic, Hill Country Clinic. So I kind of have perspective on all of these things. So what do you do to find a dentist that's right for you? Well, first of all, you need to decide what your primary goal is with finding this dentist. Maybe you're optimizing for quality and for robust communication, and that's where I really want to spend my time. I think you will have a better experience if you can talk with your dentist, if you can have a relationship with your dentist that is one where you have honest, two-way communication. And there are a lot of really good dentists in Reading. If you haven't experienced that, I'm sorry, but I think that there are a lot of really good dentists and very good specialists in Reading. So for our patients, my goal is to create that relationship through our new patient exam and onboarding process so that we can have a really good two-way communication relationship. I'm looking for long-term relationships with my patients, and that means our quality is very aligned, and that means our interests are very aligned, because I want to do great work, I want you to have great work, and I want that work to last selfishly. I want you to come back every 6 months or every 4 months or at least once a year, and I want to see that what I've taught you, what I've done for you, and what we're doing as a team, I want to see that last. So in doing that, we have to have good communication where you can tell me what you need, I can tell you what I can do for you, and we can meet in the middle. And a lot of times that's making sure that what you need is based in reality. So it's something that is something I can deliver for you. And also, I need to know where the gaps are, what you don't understand, where we're missing, like whether it's an oral hygiene issue, an understanding issue, or whatnot. So by talking, we're able to achieve that. And I think there are a lot of dentists out there that are able to deliver that for you. Now, who are those dentists? Well, I think, number one, I would look for someone that owns their own practice. And why? Because that means their patients are their bosses. And that might be a hard thing to discern, but I think it's an okay question to ask. So, hey, who owns the practice? Are you the owner? In dentistry, there is still a large percentage of people that own their own business. They might own several practices, but there is an owner, and you're able to see that person as a provider. So I think you want to have as little of org chart between the person that's providing you your care and the owner. In medicine, that's not really possible these days, or it's really rare, but in dentistry, that still does exist. So I think if you can look for and find that person, I think you should try to do that. So that's one of them, is the communication. Can you talk with them? Does the person own the practice, or is it a big corporate thing? Okay, the last one, and this is the bonus one. I think you need to go and see someone that takes pictures or is able in some way to show you examples of their work. And I think that could be, for some providers, that could be 3D scans, or that could be some models. They could say, hey, look at, like a lot of orthodontists. I remember going to my orthodontist, they had a whole wall of before and after models, and so I'm sure the dentist was really proud, the orthodontist was really proud to go grab a case and say, this is just like you, we can do this, we can do that, and show you how it's done. In our case, in our office, I take a ton of photos, and those photos are actually in a book, a before and after book in our practice. I also make these videos, and we take a lot of photos. I think I have close to 70,000 clinical photos. So if you find someone that takes a ton of photos and or can show you their work, well, that's a pretty good reassuring thing that they're going to deliver for you what you need. It's not a deal breaker, but man, it does make a big difference, and I like that. Another one is, can you find someone who is involved in organized dentistry or leadership? So what you'll find is people who have more involvement in organized dentistry, whether in California, whether it's the California Dental Association, or maybe the Seattle Study Club, or maybe Spear Study Club, or Koi Study Club, or any of these other professional organizations, if they've spent a lot of time and energy and frankly money educating themselves and working on leadership and clinical skills, I think that that will translate to better dentistry for you. And maybe one of the last items I'd like to share with you is, does the doctor have a set of core values or a mission statement or a vision statement? And I think that that's a fair question as well. All of the fantastic practices that I know have a very clear understanding of what their purpose is, what they're supposed to do for you, and they're able to share that information. And in really lucky cases, you could probably even ask the staff and say, hey, what are the core values in this practice? Or do you have an idea of the mission or vision statement? And they may not be able to tell you that exactly, but I hope they can at least get you close. And if they say, no, we don't do that, or no, we never have staff meetings, or no, anything like that, then that would be a little bit more of a red flag, because you want the doctor and the owner to be investing into the people and have a clear vision of why they come to work every day. And for us, we have 3 core values. That is success in the sandbox. Okay, we want to play in the sandbox, we want to be creative, but we also need to find success in that process. I also want you to have positive patient experiences. I want our patients to be feeling like they're leaving happy. And then the last one is check in before you check out. And what that means to me is I want our staff to check in with you and check in with me, and we want to have two-way communication throughout the appointment, even before the appointment or after the appointment. So those are our core values, and I actually have them written all over the place, and it's really important for us to exhibit the behaviors that support that. So I hope this video finds you well. I hope that you have learned something. If you have any questions, maybe we can have a good two-way dialogue, a positive dialogue in the comment section. And if you found some really great dentists, tell your dentist that you appreciate them. You know, whether it's a Google review or a handwritten note or anything like that. This job is hard. The entire team, it can be tough some days because of what we do, and we're working with people and for people. So if you have something nice and you feel really great and passionate about your dentist, let them know. All right, thank you very much. I'll see you in the next video very soon. I am Dr. Chris Nelson, and you have a great day.
Go